Good morning, all. Good morning to all of you. Welcome to our very first webinar of this series entitled then Global Health. How to promote then health as well as the health of teenagers, and also put an end to gender violence in Central Africa and in Western Africa. My name is Montasar Kamel, and I'm the director of the program of the division of World Health, which is located in Ottawa.
Gabiri, and maybe I'll ask her now to come in for a moment to introduce herself. Marie-Glorieuse? Okay, I think maybe there are some technical difficulties. Marie-Glorieuse, I see you on the screen. We can't. Marie-Glorieuse, I see you're unmuted. Can you hear us? Can you speak to see if we can hear you? Okay, we'll continue while we're sorting out the technical challenges. Oh.
Hello, everyone.
Hello, everyone. If we can just ask everyone else to mute, please, so we can hear well the procedures of the webinar. Okay, so while Marie-Glorieuse, the technical, we're trying to sort out the technical challenges. I would like to introduce our webinar today. We're very pleased to say that we have more than 170 registrants to attend this webinar, so we can't really wait to really engage with everyone in the webinar, this first of the series. I'd like to first and foremost acknowledge that IDRC's head office, in which I'm speaking from today, is situated on the unceded territory of the Algonquin and Anishinaabe people, whose stewardship of the land and water we now call Ottawa dates back to time immemorial. Why are we holding this webinar today? With adolescents representing 23% of the population in Central and West Africa, the highest proportion of any region in the world, it is crucial to address the challenges they face, especially with regard to their health and safety. These challenges include child marriage, early pregnancy, gender-based violence, genital mutilation, socioeconomic vulnerability, and mental illnesses and mental health challenges. Gender-based violence and sexual and reproductive health and rights are interrelated, and this is what our speakers and our panelists today and throughout this series will be demonstrating these linkages and the impact on the health and well-being of our adolescents in Africa. However, a lack of evidence complicates the development of appropriate policies and the implementation of programs to support the health and well-being of adolescents in the region. So not being able to reach their full potential, the whole region would be suffering if we don't have the appropriate support for adolescents for their health and well-being. In its 2016-2030 health strategy, the African Union recognized this and prioritized access to comprehensive integrated sexual and reproductive services. Now, more than ever, a multi-stakeholder conversation must begin to move toward inclusive and equitable policies that take into account the drivers of sexual and reproductive health and rights and gender-based violence through locally relevant knowledge and evidence. And this is precisely what IDRC, the interface with IDRC's mandate in supporting knowledge and research to advance development agendas throughout the world. In low and middle income countries. So more specifically, the objectives of the session today is twofold. First is or threefold. First, we aim to discuss the current landscape in relation to adolescent sexual and reproductive health and gender-based violence in Central and West Africa. Second, we will talk about the key challenges, opportunities, knowledge gaps in this field in today's webinar. And finally, we will endeavor to discuss what research can do to contribute to enhancing adolescent sexual and reproductive health and rights and ending gender-based violence among adolescents in the region. To walk through these objectives, we will start with a presentation with a keynote speaker that will be followed by a panel discussion with 3 invited experts. Experts will answer 3 rounds of questions, and the audience will then have the opportunity as well to ask questions to our panelists. At that time, we will ask the audience to write their questions in the chat. We will then end the session with some takeaway reflections and some closing remarks. As I mentioned earlier, this session today is part of a webinar series we are organizing over the next few months on the topic of sexual and reproductive health and rights and gender-based violence. Please stay tuned for more information on the subsequent webinars. Without further ado, I would like to introduce our distinguished keynote speaker, Professor Techiwa Manu, who will provide an overview of the adolescent sexual and reproductive health and rights, gender-based violence, and the nexus in West and Central Africa. Professor Manu, I may ask you to turn your camera on, please. Professor Manu is an Emerita Professor of African Studies at the University of Ghana, a Senior Fellow at CDD Ghana, and a Fellow of the Ghana Academy of Arts and Sciences. She holds a degree in law and a PhD in anthropology. Her work focuses on African development, human rights, women's empowerment, and higher education. She received the 2023 Franco-German Prize for Human Rights. Professor Manu, I could go on and on and on about your bio, but I think our participants today would really love to hear from you. So the floor is yours now, please, Professor Manu. Thank you.
Thank you very much, Montessa, and good afternoon, good morning, everybody. I'm pleased to join you for this first webinar in the series. And I want to start by noting the context in which we live, where there is a growing anti-gender, anti-rights movement and mobilization. These movements are very well organized and well funded. And what they're doing is that they are resulting in restrictions of rights, including on freedom of thought and expression, knowledge and information, both globally and regionally and nationally in some of our countries. So we know that in the United States, for instance, there have been the restrictions on reproductive rights, the reversal of Roe v. Wade, the revival of archaic laws, several very draconian anti-abortion laws, rulings on the protection of fetuses, and the banning of comprehensive sexuality education in schools, increased hostility and stigmatization of sexual and gender minorities, and a rash of homophobic laws and bills in Uganda, in Ghana, in Uganda where the act has been passed, in Ghana where there's a bill, and growing mobilizations. In the next few months, that Cote d'Ivoire is the next stage for the activities of the World Congress of Families, which have been spearheading these homophobic laws. Now, it's important to note this context as we do the overview of adolescent sexual and reproductive health and rights and gender-based violence and the nexus in our regions, because they do have repercussions for development in West and Central Africa. And as I noted in my study with Baini in 2021, the intersection between ASRHR and gender-based violence has rarely been studied, but they provide a holistic understanding of drivers and challenges. And West and Central Africa particularly offers a good location for exploring the nexus due to the combined effects of war and conflict, socioeconomic and environmental fragility, poverty, and slow changes in sociocultural and gender norms that enhance adolescent well-being and rights. Next. So when we look at the statistics on adolescent sexual and reproductive health and rights and gender-based violence in West and Central Africa, they give us, an understanding of the scale of the problem, where these two regions have a highly youthful population, 43 and 46% respectively of the populations in West and Central Africa are below age 15. There are high rates of physical or sexual violence among 15 to 19 years, ranging from 13.2% in Mauritania to a high of 54.7% in Sierra Leone. Interestingly, there was a large decline in violence experienced in Cameroon and then a large increase in Liberia. So we are seeing increases and declines at the same time. As also noted in Montessa's introduction, we have very high prevalence rates of female genital mutilation and cutting among 15 to 19-year-olds, ranging from almost 14% in Nigeria to more than 80% in Mali. High adolescent fertility and childbearing, with most Western and Central African countries having rates greater than the African average of 92.9 births per 1,000 women, and high rates of adolescent and child marriage. Niger and Chad have the highest percentages, 70% and 76% respectively. Next slide, Catherine.
Tichiwa, I think you went on mute by mistake.
I'm what? My mic is on,
now,
sorry.
Yeah, now we can hear you well.
Okay, sorry.
So maybe from the beginning of the slide again, please. Thank you. Thank you.
This slide?
Yes.
Yes, so I'm saying that the literature shows up the main ways in which gender-based violence and adolescent sexual and reproductive health and rights intersect in the literature in the region. So we find that gender-based topics are covered quite widely in the literature through focus on female genital mutilation and cutting, child marriage, child trafficking, school-related gender-based violence. But we find an absence of studies on ritual bondage of girls and then child witchcraft accusations. When we move to the ASRHR topics, we find again that there is quite a bit of coverage on contraceptive use, sexual risk-taking behaviors, adolescent fertility and childbearing, pregnancy and child health outcomes. But we find quite an absence on adolescent mortality and morbidity, on comprehensive sexuality education, and on sexual orientation and gender identity issues. And yet there are clear nexus, and this is what we show between female genital mutilation and adolescent sexual and reproductive health and rights, child trafficking and ASRHR, school-related gender-based violence, and ASRHR, child marriage and ASRHR, and conflict and ASRHR. So there are these present key opportunities for key gaps as well as opportunities for research, policy, and practice. So with the research, we note the minimal knowledge production. And when we talk about minimal knowledge production, we talk about researchers in the region. It's not that these topics are not being researched, but ironically, that doesn't seem to be mainstreamed by the researchers in the two regions of interest. There is a lack of disaggregated data and silence on expressions of sexuality. And this, especially the last one, is going to be even more pronounced with the restrictive laws and homophobic uptake that we are seeing. There is also, although legal and political issues or that arena presents an area, an opportunity, we do not find much legislation and policies in the context of legal pluralism that exists in the two regions. Again, when it comes to programs and practices, we find that there are very few on comprehensive sexuality education and on changing gender norms, and that could empower adolescents and girls. So in Ghana, for example, next slide, the absence of comprehensive sexuality education has real consequences for the lives of adolescents and girls. So whereas comprehensive sexuality curricula promotes quality sexual health knowledge and protective sexually autonomous behaviors, they have been turned on its head, and cultural and religious reservations now exist about the various components of comprehensive sexuality education, because it is presented as if that knowledge would promote promiscuity among adolescents and also serve really as an introduction to LGBTQ issues. So people do not want to hear it, policymakers, about being cowed into not even picking it up. Now, these poor ASRHR issues due to lack of comprehensive sexuality education in Ghana has seen an increase, very high increase in teenage pregnancy from 14.1% in 2014 to more than 15% in 2022. About 9% and 10% of adolescent men and women had sex before age 15 years respectively, and over 16% of women and girls aged less than 20 years had induced abortions. This is all from the Ghana Statistical Service and the Ghana Health Survey. Now, there's also a lot of sexual risk-taking behavior due to the lack of comprehensive sexuality education in Ghana, where we find high-risk sex among almost 27% and 21% of 15 to 19-year-old women and men, respectively. Condom non-use at last high-risk sex was also high, with about almost 83% of young women and 80% of young men not using condoms. And then the reported rates of STIs were also going up. Another issue for the region is the current attempts at decriminalizing female genital mutilation and cutting in the Gambia, which already has very high rates. And we know that in March 2024, the Gambian government introduced a bill decriminalizing FGM, which poses dangers for women. and girls, but the mobilization that has taken place has resulted in a suspension, but not a withdrawal of the law. And so it is important that we keep our eyes on the ball. So finally, moving forward, I suggest that it is important for us to make the connections between the anti-gender, next slide, Catherine, between the anti-gender movement, the anti-gender agenda, and women's and girls' poor SRHR. We find, for example, that in my country, Ghana, laws on restricting the rights of LGBT people often have the support of even people in the women's movement, and they cannot make the connections between these attempts to curb the rights of sexual minorities and the general restrictions of rights of women. It is also important for us to expose the silences on sexuality and rights and the real foreign hands and voices behind this, instead of those of us who are seen as promoters. It's important to continue to create awareness and sensitization, to build alliances with civil society organizations, with parents, communities, and faith-based organizations and leaders, and to support even more research and advocacy. And in the final slide, I have just a list of references. So I thank you once again for allowing me to join this webinar and to share this. And I look forward to the panel discussion and to the questions. Thank you very much.
Thank you very much, Dr. Manu. This is a great introduction to this webinar today and to the whole series. Excuse me. You raised a number of very important issues, which I am hoping and we will be coming to in the with our panelists. Issues related to the interface or the impact of sexual and sort of neglect or lack of attention to sexual and reproductive, adolescent sexual and reproductive health and rights and gender-based violence on the development agenda as a whole for Africa. The interface and the intertwining of policies, laws, rights, agendas, and the importance of having localized responses that create this, where space is created for dialogue and alliances between the actors and the communities and the stakeholders in the continent and in each country and in each community to have sort of lasting change and finally, I mean, you raised many important points. Maybe the final one that really stuck with me is really the importance of education, awareness raising, and emphasis on information as a protection for the health and well-being of adolescents. It's not it does not drive promiscuous behavior. In fact, it is a protective factor against harmful practices and behaviors among youth. So I could go on and on, but not everyone is not here to hear me, but to hear our panelists. And maybe for now, I'll just hand it over to my co-moderator for today to introduce herself and the next segment of the webinar, Mary Gloriose Ingabiri. Please go ahead, Mary Gloriose. We can't hear you, Mary Gloriose. We can see you, but we can't hear you. So while we are sorting out this technological, it's always like it has, of course, every webinar has to have some technological challenges. What would be a webinar without some technological challenges? So while we're sorting this out, we'll move on to the panel segment of our webinar. We have very distinguished speakers and panelists who will be I'm hearing someone. That's not you, Mary Gloriose, is it?
Yes, ma'am. Hello, everyone.
Okay, hello everyone. If we could just mute until your turn comes to speak, that would be fantastic. Thank you very much. So, okay, as I mentioned, let us go on to the next segment of our webinar. Je vais maintenant demander à nos panélistes de bien vouloir allumer leur caméra. Madame Thiou, Dr. Diop, Dr.
Panel to activate their video. I am really happy to present the members of the panel. Please note that we are posting the complete bio of the members of the panel. We have the pleasure to have Aminata, Executive Director of the National Alliance of the Youth for Family Planning and Health. She is a lawyer in public right. She has she has worked a lot to prevent violence in her country. Dr. Jacques Emina B. Ofuya. He is a consultant on population dynamics and a policy advisor at the UNFPA at the Regional Bureau for West Africa. Before UNFPA, he was professor at the University of Kinshasa and director of the studies on development. He is currently the vice president on population studies, and he coordinates research programs that include 42 research centers in 19 African countries, Asia, and Oceania. Welcome, Dr. Nafissatou Diop. She is the director of the project of the Sahel Women Empowerment and Demographic Dividend Project in UNFPA at the West and Central African Regional Office based in Senegal. She is expert in social sciences and public health, and she has more than 25 years of experience in the gender equality and human rights. Before her actual post, she was a coordinator of a joint program between UNICEF and UNFPA to fight against female genital mutilation in 17 African countries and in the Middle East. She is responsible of the gender department of the UNFPA based in New York. Welcome, Dr. Diop. Now that we have made the presentation, we will ask the first round of questions, and each of the members of the panels will share its perspective in less than 3 minutes so that we can be in time and so that we can have the possibility to give the floor to cover all the subject matters. The first question is, can you give us a general explanation of the situation in Central and Western Africa in terms of need, priority, and expectation? Secondly, can you see how is the environmental situation, how is the situation like for adolescents' health and right, and with regards to GBV in Central and Western Africa? Let's start with you, Dr. Diop. Greetings everyone for this invitation for GBV and the protection in the I'd like to say that I will not dwell upon the points that were raised by a professor. These are she has in depth treated the subject matter related to children marriage, female genital mutilation, and as well as the pushback with the increase in conservatism, not only in West Africa, but also at the international level. I think I will not talk about these points, but I would first remind that with regards to the objectives of development, we can say that the Central and African region, the Western African region, is a region that needs to accelerate its efforts to attain the objectives, objective number 5, especially on gender equality and ensuring the right of women and girls. There are evidence that show that the Western African region continue to suffer from this difficulty. Especially with regards to GBVs and traditional practices that are not tolerable, and this has important consequences on health as well as the economic development of the country. I think that there need to be we need to implement measures to fight this. First of all, maybe in the presentation, the harmful practices, including female genital mutilation, need to be raised. We need to talk about violence, domestic violence between partners that is very high. When I take the examples of Guinea Equatorial, 36%, 57% in Gabon of domestic violence within the couple. So there is this issue that is very important. In terms of violence, we have sexual harassment that are highly linked to political crisis, humanitarian crisis, and I think here we have some situations and examples that show that the violence, especially in a country like Ghana that has the right policies since a long time, have a high rate of 19% of sexual harassment. That is one of the highest statistics in the region. The situation of adolescents in the region, I think we should recognize that adolescents want to really take part in the debates, in the discussions, in elaborating programs, and their participation in decision-making tables. But how should these programs be elaborated so that they can really ensure their participation? And as adolescents, the rule that is very important is to be happy, to be in good health, to follow their education, and they have employment opportunities. and in the future support families. I would like to add one more point with regards to the political environment by saying that there had been many efforts with regards to the political environment that was established in the region, especially in the Western and Central Africa. But I would like to inform that efforts were exerted to implement the laws that were promulgated. So respecting these laws is very important, and mastering, knowing this law is very important. That is what I have to submit for the first question. Thank you very much, Dr. Diop. This is very important and a pertinent point. I would like now to give the floor to Madame Theo. Can you give us your perspective on this point, on these two questions, please? Greetings, everyone. Thank you very much. Can you hear me? Yes. Thank you very much, Montasser. I would like also to thank Professor Manu and Dr. Diop that have intervened before me. I really appreciate this opportunity that has given to me to talk about the adolescent health and rights in Central and West Africa. In our region, this is a region that has relatively young region with 77 million youth that represent many kinds of vulnerabilities. They have needs and obligations. In terms of expectations, I would like to stress the importance of access to health facilities. This is a generation that is characterized by an easy access to the media. So this youth would like to have access to simple health services, and it's important that they have access to this type of services. The second point is that this youth need quality service. That means that they should be respected in health facilities. I would like to give the floor to give an example with regards to family planning. We would like to increase the use of contraceptives in the region, but according to my experience, I would say that the adolescent population abandon using contraceptives because they're not given much attention. They are against contraceptives, that they have chosen to abandon the service due to many reasons, specifically related to quality service. These youth need to have access to inclusive interventions, especially the youth that are not educated, that that are unemployed. There are needs in terms of participation. This has already been mentioned. There are progresses, but we observe that there is that the civic space is no more active, and the youth do not participate in the elaboration of these policies. Their participation is limited, and decision making is therefore limited. With regards to education, this has already mentioned. We are living in a clear situation. Many are hostile to abortion. What we see is that if I take the example of Senegal, adolescent girls, even those that are victims of incest and rape, do not have the right to abort. So they try to have services in a clandestine manner for abortion, and some of the youth have needs and expectations, especially those in conflict areas. We have major conflicts in the central part of the continent, in the Sahel region, and this has an impact, a negative impact on the services and the education given to the youth. So the youth expect that this situation improves. As everyone said, there were many progresses, many participation, many promises made within the region, whether it's at the African Union level and at the ECOWAS level. But we can see that there are policies and national strategies that are elaborated in each country of the region. But in reality, we also observe that with our governments face many difficulties to keep their promises and have concrete actions. Thank you. Thank you very much, Madame Thieu. These are very pertinent and important points. What you said about the humanitarian situation, the importance of ensuring the participation of the youth is important. Their voices are not there, and you also underlined the access to quality services and also opportunities that are available with regards to policies that should help us improve the service given to these adolescents. If I may add, Dr. Emena, if I may give the floor to Dr. Emena, if you would like to add a few points on this. Thank you. Thank you very much, Montasser. It's very difficult to take the floor after experts, excellent experts. I would first of all tell you that I'm not working for this network anymore. This is just an additional information. And to come back on those two questions that were raised, I'll first and foremost talk about these 23%. If we take into consideration the more than 600 million inhabitants of the Central and Western Africa, and 23% of this is a lot. So this is more than the population of a single country. Imagine, when you talk about this part of the population, you try to minimize 10%, 20%, but just take in real terms, this is an important number. That is my first point. So the situation is preoccupying. The situation of the youth is preoccupying. What can I add with regards to this? Our youth face major problems with regards to reproductive health. But in what context? We have insecurity and the youth are living in global insecurity. When I say global insecurity, I am alluding to economic problems related to unemployment, to the lack of employment, to related to food insecurity. I'm also alluding to sanitary problems, so they don't have the access to the right services. I'm also referring to community insecurity related to norms. And I'd like to remind you that we are living between tradition and modern life. So we said that we have negative traditions, but we cannot abandon tradition, and we cannot embrace modern life in its entirety. With all the conditions that we endure today, the situation is very alarming because we're living in this insecure environment. With climate change, the youth are obliged to migrate, and this exposes the youth, girls and boys, to some kind of risky behaviors. And apart from this, there is physical insecurity, political insecurity. I will not talk about armed conflicts again. In this is the context. There is rapid urbanization that is oftentimes not planned. Our youth, young girls and young boys that are living in cities, are in an insecure environment. And it is the case also in rural areas. I also would like to say that televisions and social media exposes the youth to a certain kind of behavior that poses a problem to their future. So we are more concerned about the situation of the young girl. This is important because when we educate a girl, we educate a nation, but we should also give an importance to boys. They are supposed to live together, which means that it's not normal to live in this kind of situation for both. Where are we heading in this context? There are still practices that do not allow this youth to strive. Wellness should also be considered in the society, and they should contribute to their society. Unfortunately, the situation is problematic. We have also the problem of GBV, of early pregnancy, early marriage. So, and that the laws are not also very well applied. I will give you an example. There are some countries that have ratified the Protocol of Maputo that stipulates that in case of rape, we can have abortion. But in many African countries, it's clearly related that sexual relationship with an adolescent is illegal. But when an adolescent is pregnant, it is considered as a gender-based violence, but she doesn't have access to abortion services. But the situation is really complex. And apart from this percentage, these are human beings. We're not talking about numbers, but human beings. So the situation is alarming, and we need to integrate boys in many of our programs. The program of positive masculinity need to be reinforced so that girls and boys can have the same vision regarding violence and etc. This is what I have to contribute with regards to these questions. Thank you very much, Dr. Emina, for this important points. I would like now to give the floor to Marie Gloriose, and let us try this time. Yes, can you hear us? Yes, perfect, perfect. I'd like to give you the floor for you to continue. Thank you very much. Thank you. Thank you very much, Montasser. My name is Marie Gloriose Ingabire. I am the regional director for West Africa, Central and West Africa, based in Senegal. I'm very sorry for the technical glitch that we had earlier. Here I am now, and I'm really happy to be amongst you. I heard that there are more than 150 participants. That is great. I would like to welcome the members of the panel, as well as Professor Manu, as well as Professor Diop and Dr. Emena. Without further ado, I would like to go to the second part. And I'd like to ask this question, Madame Diop, as a practitioner working with the youth in Senegal, what do you note as the principal challenges with regards to adolescent health and rights, and what exposed them to GBV? Madame Diop, you have the floor. Thank you very much. Thank you, Madam Director. I would say that I am at the regional bureau, not only in Senegal. Excuse me. The question is for Madame Thioy. And I'll come back to you, Dr. Diop. Thank you. Thank you very much, Marie. Thank you very much, Marie. With regards to the challenges at the political level, we have challenges. The emerging questions need to be regarding adolescents are not very well integrated in our interventions, policies, and programs. I am giving the example of positive masculinity. There's the mental health. There are mental health issues. There are also problems related to obstetrics services. So these are emerging questions, main issues in our policies and programs and interventions. There is also the superficial leadership. This is a reality, whether it be in countries of the region and at the regional level.
Montassia dans son introduction. Jusqu'à présent, il y a ce problème de disponibilité, de désagrégation, alors que nous savons qu'on ne peut pas gérer ce que l'on ne mesure pas et que derrière toute bonne politique, il se cache ce qu'on appelle des bonnes données. Il y a les défis par rapport à la santé digitale aussi.
As well as the health issue as well in terms of how to have access to this type of services. And nowadays, this type of health issue seems to be is going to facilitate this type of access for type of the teenagers. It is becoming a determining manner the use of this type of services by the teenagers mainly. There are other challenges with respect to the sexuality, for example, when there is a conflict, very much like in Western Africa and Central Africa, it would be good to try this type of method of defense, and also to integrate really whatever is related to migratory policy as well at the level of the region as well. Now, with respect to the entity and organization of the civil society as well as others, in terms of challenges, I would like to say that we need to improve our working approach. Why? Because there are plenty of elements to be done. There are certain progress at the level of the legislation. If I take the example of Senegal that I master very well and I'm very much familiar with, there is the advocacy around the children that we cannot manage to get it adopted. There is also the advocacy also for early marriages, and so far we have had no success advocacy with respect to abortion authorization, and we've had no reply so far. So we would need to have a strategic collaboration with the different actors and with the decision makers. Civil society would also need to progress in the way how they are working indeed, and to try to act more on a small scale primarily than the organizations, as well as the civil society would need collectively at the level of the household, that we need to go also to the domestic household in order to speed up the change. Now, with respect to the specific challenges, now with regard to the youth, for example, I would stay probably to focus on women. Why? Because we have been working with women, girls, as well as teenagers, and we have this trend where there are some collective actions indeed, and there are other type of actions that can be done at the level of the teenagers. If I take the example nowadays, the stereotype as well as social illusions, and the example also of this issue means that as young girls as well as women, and mainly girls, we try to focus more on this, and we focus more on the appearance of that we are lacking mainly certain data in order to get trained and to have some confidence, trust, and to have new focus of interest in order to help us more and to be less exposed to what we would call economic violence, mean that you had highlighted and mentioned earlier on in your certain speeches. So generally speaking, I would say these are red flags, red lines in terms of challenges indeed, as far as the teenagers are concerned in Central Africa and Western Africa. Thank you. Over to you. Thank you very much indeed, Mrs. Dio, for your formulation, for your clarification, and also for having highlighted the different challenges at different level. Now I would like to give the floor to Dr. Amina to tell us more, given her own experience in the work in Central Africa. What are the main challenges that you would like to talk us that would hinder us and to or is not helping us to obtain good outcomes for reproductive health for teenagers? Thank you very much indeed, Marie. Now, the other speakers had already provided you answers to a certain number of elements, but I would like to highlight and to insist on the lack of the policies which is based on certain evidence. Indeed, several policies indeed are not based on real data as well as facts indeed. So I'll provide you with some examples, if I may. We have noticed indeed, and we continue observing and noticing, despite the current situation, certain sectors and in certain countries as well, some improvement in the field of health indeed. There is a decline and prevalence of early marriages as well as teenagers and as well as certain violence in certain countries. But nevertheless, sometimes the policies are investing money where it should not be invested. Why? Because we don't know what is the source of this main change. So the researches that we have conducted so far in several countries in Western and Central Africa are highlighting that according to certain countries, the different change that we are noticing do depend. Certain changes emerge or come because of the dropping out in certain countries. So, or schooling does enable sometimes them, but it is not enough. In other countries, they happen to be the programs which are being implemented. Indeed, they do amplify, they improve also the women's status most of the time to reduce the youth precarity, etc., etc. But nevertheless, if we are making these type of policies without taking into account these outcomes, we may invest where we should not invest indeed. And there again, simply why this is the case, because several of our programs are financed from the external world, meaning that the countries or our countries are not putting the right resources, the right means within the framework of our own national budget, and they are not really trying to improve sexual health as well as reproductive health of our youth. That is our main problem. It needs to be a national concern rather than waiting for the money which comes from the sponsors. Meaning that very often what happens, we start a program, but when the financing is no longer available, we can no longer continue. And then we go back to the starting point, meaning that since several the money which comes from the external part cannot finance the programs in all the countries, you will see there are certain inequality at the level of certain region, etc., etc. Some of them would benefit more from certain interventions than others. So we need to reach up to correct this and to adjust it. So there is a implementation which seems to me rather weak of the different policies and programs. Policies are there with some text which seems to be interesting, but we do not succeed to guarantee the implementation of this. And to do the follow-up and to the traceability and to assess these programs as well. Sometimes we invest indeed, but following that, we do not know how to assess, how to evaluate the impact of this program. And then there is also certain approaches as well. Most of the time, you may find the same problem in the health sector, which is working on specific sector. But nevertheless, there are no educational aspects. People from education are working within their own framework, whereas the global, holistic approaches, multi-sectorial ones, would be much better indeed to be implemented in order to come up with a solution at its own base roots. This is what I can say. I know that it's rather complex, rather complicated indeed, but nevertheless, I think that the approaches, overall approaches, holistic one, as well as systemic, would be much more appropriate in order to solve the problem of the teenagers, men and women, and not to focus only on girls, as I had stated. We need to put them, merge them together, even if they're different, in order to advance. Thank you very much, Doctor, to highlight and to tell us more about the importance of the policies, which is based on evidence as well as research evidence. And we certainly come back to that with the very last round of questions. Thank you very much indeed. Let me give the floor to Dr. Job now. Having heard already these different stakes, these different challenges at the level of the policies, according to you, what would be the interventions that would need to be adopted in order to create a political landscape that would be adaptable to this type of challenges resolution in regard to the gender violence bills that do exist in the region? You did say earlier on that you've been working in the whole region in Central Africa as well as in West Africa. You have the floor, madam. Thank you very much, Mrs. Director. I would like to start, first of all, where my colleague had just stopped. So I would like to carry on the same way. That would be mainly to focus on the intervention models, multi-sectorial models, of course, meaning that in order to implement a type of synergy between the different type of interventions in the field of reproductive health, as well as intervention of the protection of the teenagers, men and women, as well as education, mainly to focus on enhancing economic opportunities and the whole rest as well, in terms whether hygiene as well as health, etc. Meaning that in this way we would call in our own jargon, or we'll try to implement some programs that would take into account the ecological model, meaning that We would need to make use of some intervention circles that would go from the individual up to the community at the level of the society as well as at the political level. So at the different levels of interventions needed to work together. And as I stated, they would need to impact all those different fields indeed that are framing the teenagers, men and women, of course, girls and boys. It's very complex, very difficult, I must admit. It's more of type of challenges. It's rather difficult to have this type of coordination, this type of synergy. But we are aware that if there is no synergy, it's not going to be operational. We're not going to have any type of outcomes. If you are going to end up by having an outcome in one field, then we will find a gap in another ones. And this is how we would not have the full potential of the intervention which is being carried out in one field. Very much for the case, for example, of education is rather precarious, as it's been already stated already. But so that for girls to remain at school, we will need to have a system of protection whereby we will need to have education that we call the comprehensive education, which is going to enable us to enhance, to strengthen these type of items of protection, comprehension of hygiene, etc. So a whole type of set that would enable them indeed to achieve its full potentiality. I think that it had been well stated today. So this type of coordination that needs to be carried out, multi-dimensional one, need to be done, plenty of efforts need to be carried out, and people working in this field, we need also to support them in this orientation. There are plenty of manuals as well as tools and that have been identified to provide answers and to this type of issues. For example, these strategic interventions, for example, very much like the issue of enhancing some skills and competence on relation as well as strengthening women's capacity and women empowerment to make sure that services are available, education, health, reproductive health, that poverty would be reduced, that the environment would be safer, and that teenagers would be feel safe. And of course, there is also another field, which is transformation of a certain attitude, certain behavior with regard to what had been already stated. I think that in our region, there are plenty of elements which are also taking into account several countries, and I would certainly talk about the overall program of children marriage, where 12 countries are being involved, as well as genital issue, which is does involve 17 countries. 8 of them are in the sub-region, and very often the programs where the work was based on certain research and outcomes which had enabled us to show concretely some interventions which have been rather successful indeed for education and to keep the girls at school. So we need to go through this type of cash transfer system with some politics which are improving this, but to make sure, concretely speaking, that we need to support these girls so that they would remain at school. Nutrition, 1 meal per day is very important to make sure that they would have at least 1 meal per day. And the other point that I would like to highlight probably very rapidly would be related to women empowerment as well as girls empowerment. So within the program that I am managing, which is the SWED, where there are some spaces at school protecting girls with the support of the school director as well as the teachers, mentors as well, and other type of spaces for the girls, dedicated for girls. Unfortunately, some of them had already left the school. So these are few examples which have been rather fruitful indeed. And of course, I would need also to talk about the access to information, the issue related to access to information. I need to say that we happen to have an issue related to this lack of information related to well, sexual information or sexual health indeed. However, if we talk about educations in general, or let's say family education as well as local education in the type of local languages, there is an issue. And I would like to state that in 12 countries currently, for example, there is what we would call this type of education to the family education, where we are taking also certain elements related to sex education, and it's a program that would last 6 months and had also shown how we could have this type of intervention that could be very fruitful and would impact several children indeed with the support of the government. Hopefully all this is doing really well. So we need to understand the difficulties within the framework of certain terminology, the language which is being used. Also, we need to know exactly how to adapt certain methodology for this whole region of Western Africa. And thank you. Over to you. Thank you, Dr. Diop, for this very rich intervention indeed. Thank you to the three of you for having told us about these type of challenges at the level of the policies, as well as the different voices, the different gaps.
De la recherche pour pouvoir avoir ces investissements-là qui sont plus efficaces. Parler aussi des approches qui sont très importantes en termes de coordination, collaboration, multisectoralité, mais aussi des approches multisectorielles qui, entre autres, poussent à avoir au centre les jeunes comme entité à part entière, et c'est très bien aussi de pouvoir identifier ces interventions, ces initiatives qui fonctionnent. Ce sont des opportunités dans notre région, l'existence, comme vous l'avez mentionné, d'outils et de guides pour nous en servir, des interventions au niveau de l'éducation, l'autonomisation en général des filles, mais aussi l'importance de la contextualisation des interventions à mener dans la région. Alors, si vous permettez, on va passer au dernier tour de questions. Je vais commencer par vous, Dr. Emina. Vous avez déjà touché l'importance des politiques et des pratiques basées sur les évidences. Donc, pour vous, comment la recherche peut contribuer à lever ces obstacles et quels
contribute to this type of obstacle? And what are the research units that would come into your mind? Thank you very much indeed. Thank you for this contribution, for this question. So the research does provide some impact and does show some impact observations as well as the different challenges. So it does highlight also which is not fruitful and which does not function. And this research does show how we could suggest some solutions, meaning on how we could improve this situation indeed. But the problem is here, and we need to how the main question would be how to move on to the research result for the program. This is where we have the problem indeed. Because generally speaking, in Africa, in Central Africa, as well as Central Africa and Central Africa, there is very few dialogues between the policies as well as the decision makers, indeed, and the different stakeholders, very few indeed, meaning that the program would mean that very often seems to be exceptional, and we work with some universities and others. But now the majority of them, whether researchers or the work of the academician, does remain at the university and are going also being presented in big conferences where decision makers do not take place, meaning they do not know. So that is the main issue that we have. We did require plenty of research
Et les pays africains, surtout de l'Ouest et du Centre, ne financent
Western and Central African countries do not finance research. It means that research are financed by external parties, so the result is mitigated. This is an effort that should be concerted at 2-3 levels, meaning that researchers should do the needful, not only to improve policies, but to work with communities. So the communities need to be informed of the process, the conception of the study, from the conception of the study to the publication of results. And here, policy makers will be very well informed. Without this, it's impossible to advance. So policy makers need also to work hand in hand with researchers. I'm ending. So to conclude, I would say that research that should be undertaken by the country, because I say this because countries will undertake studies based on their needs. If we undertake a study on early marriage in Ghana, it would be the priority of Ghana. GBV is not the same in all countries. So each country should try to identify its own priorities and undertake research in these fields. So concrete actions can therefore be proposed and implemented. So that's what I have to say. Policy makers need to work hand in hand with researchers. Thank you very much. Thank you very much, Dr. Emina, Madame Thioy. Can you share with us specific examples of policies that can bring about change to improve reproductive health rights within the adolescent population? You have a minute and 30 seconds. Absolutely, no problem. I would say swiftly, as Madame Diop underlined, with regards to the space in sub-Saharan Africa, we have good policies. We have the recent engagement of AOC, even if the space is a bit political in our countries. We see new initiatives with regards to families, but if we seize these opportunities, this can be a good policy that can accelerate the results. Vulnerabilities exist within families. So this approach would be a good practice if it is well implemented. The cash transfer that is mentioned is also a very good measure. We note that it would be preferable to build the capacity of adolescent groups. I take the example of adolescents that are single mothers. Their opportunities, their access to different opportunities is limited for them. Let us same thing for schooling. These girls that endured this problem need to be focused upon in the different initiatives, including cash transfer. There are also initiatives related to research. We need to implement collaboration initiatives with different actors, including researchers. This would, in the future, help us solve this problem. Thank you. Thank you very much, Madame Thioy. Dr. Diop, You have the floor talking about research. What would be the research opportunities that can catalyze the political environment and can have a positive result on health, adolescent health and rights? Many has been said by the previous speakers that I would like to applaud. I would maybe add one thing. First of all, I think when we talk about this field of gender-based violence, health and rights, we need to undertake operational research or applied research. I like research. I really like it, but there are different types of research. There are research that are fundamental and important in the medical field. When we talk about reproductive health and rights, we are in the same domain. We are also in the domain of social norms. So here, I would like to call upon you all that research be done, the research that are useful to policymakers be done. We should not wait 2 years to apply a research that has been undertaken. So we need applied research that can really take into consideration issues and challenges of today, of governments, of adolescents, and all actors in general. My second point with regards to research is that to do advocacy work, we don't have many researchers in positive masculinity in the sub-region. So we should see how we can build and strengthen research to include issues of men and boys on this issue of positive masculinity. We need to recognize that if boys and men have a problem, this is related to violence and also reproductive health. And women are suffering because of this. So we need to understand the mentality of these boys and men. Sometimes there are problems related to mental health. We should see what this positive masculinity represents for the population of the sub-region. But we need to try to advance, and we need to recognize that there are practices, negative practices for the development of this continent. Thank you. Thank you very much, Dr. Diop. You have evoked very pertinent points and that are very important. And I think that in the context of our mandate, these points are in line of our objective in the future. Thank you very much. We are only left with 4 minutes. I don't know if it would be possible to have an interaction with the participants, but we don't have questions in the chat book. There's only one question with regards to the participation of the youth in IDRC. I don't know if there are colleagues online that can tell what is going on in the ADOS program in Senegal and showcase how the youth groups are working with researchers in Senegal and show their engagement. This is in line with the leadership and empowering component that was just mentioned. We would maybe share a link in the chat so that the person who has asked the question and other people could see what is being done. And they can also see how we intervened in the context of this action, and see how these adolescents have become change agents. If you allow me, I will ask our members of the panel, or maybe for Professor Manu, if you can, in a single sentence, I know it's not easy, but really in one sentence, to give us an important point to remember of the session. I'll start with you, Dr. Diop. Professor Manu, please take the floor.
Very much, Marie Glorious, and thank you very much to the panelists. I think that it has been really insightful how we have reiterated each other's points. We live in a very difficult region, and yes, there has been some progress, but there are also many challenges. I mean, we did not mention COVID and what COVID has done to our economies. I did talk about the growing anti-gender movements, and I think Dr. Amina in particular also highlighted the insecurities, but also the issue of a certain use of decolonization, of decoloniality in a negative sense that reinforces many of the positions of the anti-gender movement. So we are seeing this growing nationalism, which is also a threat to even some of the efforts. I liked particularly the reinforcement of the issue of multi-sectorality. I think that in the study that we did, we showed that you cannot approach these issues in silos, as is often the practice, and that it is important that we get all these perspectives. And then the positive, I think we frame adolescents and youth often as a problem, but I am going away with this reinforcement of the positivity of the youth and adolescents. They are interested in their societies. They want to see a future. They want to participate in both the civic, the social, the political lives of their countries. And it is often truncated. So like Madam Diop says, if girls leave school, then some of the programs that are being done in schools are closed to them. So how do we recognize this positivity of the youth themselves and integrate it in our actions? Like the way in which the international community handled the renegotiation of the Beijing platform for action. I think the various speakers have highlighted the fact that we have a lot of commitments. The issue is, how do we monitor compliance? What are the incentives? So if you go to the Maputo Protocol or the SDGs, the goal on gender equality, etc., or many of these things that we're talking about are there. So we don't need new commitments. What we need is a way to ensure that our countries, our governments, our communities recommit to these commitments and implement, because the issue is about implementation. What are the actions? Yes, the research shows the gaps, the opportunities, but we must also move forward. So whether we're talking about action-oriented research, applied research, etc., in the end, it's about implementation. And how do we really catalyze policymakers and communities to move? We have this regions, these two regions, with very, very slow changing gender norms and practices. We cannot afford to wait. So what can we do to move things forward? Thank you.
Thank you so much, Professor Manu, and thank you really for emphasizing the point that to really address these issues, it's everybody's effort. We have to work together, but also living with us that note of optimism that we can get there if we really commit to it. Donc, merci beaucoup. Alors, Dr Diop, disais si vous avez un message clé pour...
Do you have a key message to share with us? And I'd like to apologize. We have largely surpassed the time. I would like to say that we need to develop some data and have investment cases, thematic investment cases. We need this today, meaning that the financing research and programmatic activities and changing policies can only be possible if countries and our governments invest in a serious manner on these issues. And for investment to happen, we firstly need to talk about other negative practices, access to reproductive health services, and the economic issue. Economic development is a priority to all governments of West and Central Africa. How can we advance our countries so that we can be on the right development path? We have a large human capital with more than 600 million people. So we need to develop investment cases, present them to parliamentarians, presidents, and this data do not exist. When we talk about investment case in the sub-region, we are obliged to take the statistics from elsewhere. We don't have the right data to be able to do this call, to make this call. Thank you. Thank you very much, Dr. Diop. It's having this data is very important, as well as having an investment case for our countries is indispensable to benefit from the youth of this part of the continent. Do you have a key message to share, Madam? Yes. I would like to stress what has been said by Madame Diop with regard to resources. We can see that we do not use the available resources. Rationalizing resources is a problem. We have many resources that are not used in an efficient manner, and the issue of resource rationalization should be proposed so that we may avail more resources. Countries like Senegal has advanced on this type of issues, and it's urgent and important for our different African countries. Public-private partnership is also an issue we need to take into consideration for us at the regional level to have enough resources in order to have access of basic health services. Sometimes we tell us that we need to take a nuanced approach. Some people don't like don't want to talk about the problem because they have this sentiment of loss. So we need to consider each difficulty and challenge as an opportunity that will enable us to advance. Thank you. It's important not to be timid. In this cases, Dr. Emina, you have 1 minute and 30 seconds. Thank you very much. I would say that if we want to have adolescents that would contribute to the development of Africa, we need to take care of them since their birth. We need to prepare them since their birth. For this, we should not exclude parents. The process is a global one that takes into consideration everyone. And here we'll attain the needed objectives. Very good conclusion. I will now give the floor to Montasso to conclude this webinar. Thank you very much, Marie-Glorieuse. And I would like to thank all the members of the panel.
On reproductive health and rights and gender-based violence in Central and Western Africa, I extend my deepest gratitude to our distinguished keynote speaker and panelists for their invaluable insights and contributions. Today's discussions have highlighted the critical challenges and opportunities we face in promoting sexual and reproductive health and rights in Western Central Africa. We have heard strong evidence that comprehensive sexual education, accessible healthcare, strong legal frameworks, and the integration of addressing the issues, all these issues together, and having the space for the voice of young people and the communities, all will significantly improve the lives of women and girls in the region. Let us build the momentum generated today to drive forward research, policies, and programs that empower adolescents and communities in West and Central Africa. Today's webinar, as mentioned earlier, is the first of a series that we're planning. Announcement will be made soon on the second webinar in this series, so please stay tuned. Thank you for your active participation and dedication. Together, we can achieve significant progress in sexual and reproductive health and rights and end gender-based violence in Central and Western Africa. And so having research and evidence and the use of that evidence, as we heard today, will be key to achieve that goal. Thank you for joining us today. Have a great rest of the day, and we look forward to seeing you in our future webinars in this series. Have a great rest of the day. Thank you. Merci beaucoup tout le monde.
Thank
Au
you.
revoir.